Oh yeah, thanks for filling out the questionnaire. What I'm going to do now is try and give you as much information as I can, just in a few minutes, about the area in question that you're getting pain and the sort of. I obviously see lots of people, so there's patterns of symptoms. So I'll give you the sort of likely sort of causes. Obviously, I can't make it sort of individualised too much to you because we need a sort of two-way dialogue to get a diagnosis. But hopefully you'll find it useful. So I can see that you've got back pain spreading to the hips, stopping you from moving properly, affecting your sleep. So yeah, I say I'm concerned, but not because I think there's anything sinister going on. I'm concerned that it's affecting your sleep and your exercise, and sleep's the primary way that we recover and recharge our batteries. Sort of both our body recovers when we're asleep and our mind recovers, and exercise is important for keeping fit and healthy. So I'm sort of thinking this is I'm right. We've got to get this sort of sorted. It looks like you've only had it a few months, so that's good. So I'd be interested in what's changed over the last sort of period of time. Sometimes we don't sort of really realise, but we've been maybe doing a little bit less, or we've been more busy with work, sitting more, stuff like that. So I'd be trying to look at what's changed over that time, because the bits that hurt are usually the victims rather than the culprit. So I'd be sort of thinking, right, if it started in the back, is the back the victim and it's getting overworked, or did it start because maybe I mean, our bodies are chronically sort of understimulated in modern living. So we came from primates, so we'd be jumping, climbing trees, squatting down, running around and stuff. And if we're busy working at a desk job, then we're sat there, we're not even doing, and even just running, we're not really using these big, strong sort of hip muscles. So I'm wondering in my head if possibly the hips have lost a bit of strength recently, and that's then affected, made the back work harder, and that's causing it. Or if we've lost some sort of ability to use the core muscles, so the sort of the big strong oblique muscles and the sort of abdominal wall and the chest. A lot of our power comes from our core, really. So if you think of trying to throw something, you twist and throw, like a boxer punching, they twist, a golfer hitting, they twist, a rugby player stripping a ball, they twist. That's where all the power is. So that could be causing the back to be overworked and then sort of spreading into the hips. So it could be referral into the hips, or it could be sort of more. So I'd be trying to look at if I think it's coming from more above and spreading down to the back and the hips, or if it's coming from below and up, and if it's a lack of sort of stimulation there. I'd be really keen to sort of try and figure out what you can do as far as, let's keep you exercising, but maybe we need to switch it around a little bit. See, maybe like swimming, bike, something like that, just to keep your body moving, because it's going to help in some way. Sleep, obviously, we can go through the sort of common things to sort of help with sleep if that's the sort of thing. Obviously, the pain's the big thing that's taking the sleep away from you, but sometimes we need to sort of almost work on all the other factors whilst we sort of get the pain under control. Hopefully, we'd be able to get it under control fairly quickly. But yeah, I think in summary, I, I would be really interested in trying to understand what's changed. I'd be interested in thinking, right, I'm going to consider the back and the hips are the victims here. So is that they've had uh, they're either getting overworked, so we're looking at a lack of sort of dynamic sort of thorax movement and strength through the abdominal wall and stuff, or we're looking at lack of stimulation through slowly doing less and then losing strength and then not being able to do it. So that's where I would think. So hopefully that might of yeah be of some use. Obviously, get in touch if you want to discuss it a bit further, or book an appointment if you want to go through and get a proper diagnosis. Bye bye.